test, and is it better to go for a COVID test or a CT scan?
See, again, when should we do a COVID test? Some people can do it on a preventive measure also. Someone who is really traveling in crowded places and going to public gatherings and really wants to find out for himself, has he got infected or not? Because as I said, people can be asymptomatic also and still be a carrier. So if you just want to find that out, you can do a test anytime. But obviously, the moment you find any symptom of the generalized symptoms which I spoke of, which is fever, cough, or breathlessness, body ache, first of all, you need to consult your doctor. I don't say that just because of the symptom, you can directly go for a test. It's always important that you consult your doctor and take his advice before you decide doing the test. And what test to do? Obviously, there are these two tests which you spoke about. Should I do the swab test, which is the RT-PCR test, or should I do the CT scan? Now, both of them have been recently followed by doctors and the medical fraternity as quite confirmatory tests, where we want to see the impact of that infection on your lung also. So a CT scan of the chest tells me whether your lungs have got affected or not, and which we diagnose basically on a certain type of an appearance which is seen on the lungs, which is very specific to the COVID infection. And that's how we come to a conclusion that you have suffered from the COVID. But it's quite possible that it's not really affected your lungs and it's still only in the upper respiratory tract, which might not then come onto your lungs. So then the swab test would be able to detect whether you're still positive or not. So definitely I would say as the first test to do, it was better to do a swab test, which is the RT-PCR test, which can detect people with mild symptoms also. And obviously, if I want to see whether my lungs have got affected or not, I can think of doing the CT scan of the chest.
Okay, I'm going to have to go a little